Welcome back to the stage, emergency room physician and co-host of The Doctor's Show, Dr. Travis Stork, and the Promoting Healthy Lifestyles panel members, Senior Vice President, Medical Affairs at the Joslin Diabetes Center, Martin J. Abrahamson, MD, FACP, President and CEO of Desert Regional Medical Center, Carolyn Caldwell, Director, Division of Juvenile Justice, California Department of Corrections and Rehabilitation, Michael Miner, Chief Wellness Officer, Sanofi US, Michael Sokol, MD, MS, and Health and Wellness Advocate, Montel Williams.
First and foremost, I want to thank all of the panelist members for being up here. I know it's late in the day, so I hope everyone's had a little bit of caffeine because we saved, in many ways, the most important panel for last, and that is promoting healthy lifestyles. Why should you care? Why does it matter? Promoting a healthy lifestyle, why does it matter? Well, the goal of this panel is to convince people that we can and need to prevent illness before it happens. Why does it matter? 7 out of 10 people in this country die from chronic illness. Many of it is preventable. We're going to talk about that. We're going to talk about promoting a healthy lifestyle because it affects each and every one of us in this room. And again, if you are streaming at home, I'm going to ask you if you'd like to get involved, send us your question via text or tweet. You can do #HealthMatters2014. And I'm going to ask all of you a question that I'll answer in just a little bit. And the question is, what percentage of healthcare costs are attributed to chronic diseases? Is it A, 14%, B, 28%, C, 56%, or D, 75%? So go ahead and text or tweet us your answers. We'll reveal the results in just a little bit. And at this time, I would like to allow all of our panelist members to explain to all of us why you care about this whole idea of promoting healthy lifestyles. And we'll start with Dr. Abrahamson.
Thanks very much, Travis, and my thanks to the organizers and the Clinton Foundation and the Health Matters staff for the invitation to come here today to spend some time talking to you. I'm Martin Abrahamson, and I'm the Senior Vice President for Medical Affairs at the Joslin Diabetes Center. The Joslin Diabetes Center, which is affiliated with Harvard Medical School, was established in 1898. It's the oldest center dedicated to research, treatment, and education of people with diabetes in the United States, if not the world. The challenge that the Joslin faces is that, as you know, we're dealing with a burgeoning epidemic of this problem. Our mission is, of course, to cure diabetes, but until such time as there's a cure, our focus is on the prevention and the treatment of people with diabetes. Over the years, we've established a large number of programs, multidisciplinary ones, that focus a lot on lifestyle modification to help people manage their diabetes more effectively, as well as focusing on behavioral and mental health as core components of these treatment programs. We've seen the outstanding success of these programs. We've seen many people benefit from these programs. The challenge that we face and the opportunity is, how do we leverage the new technologies of the world? How do we use the broad number of affiliated centers that are established across the United States, including one here in Palm Springs, to help treat more and more people with diabetes, and particularly now those at risk for diabetes? We've recently established a Center for Health and Wellness that will focus not just on the management of people with diabetes and helping people realize that if they have diabetes, they can lead active, healthy lifestyles, but also for people who are at risk for diabetes to prevent this disease occurring. In 1958, just some 60 years after the Joslin was discovered and started, there were 1.5 million people in the United States with diabetes. Today, there are 26 million, and that number will grow by 50% in the next 15 or so years. In the world, there are well over 380 million people with diabetes, and that will increase to 550 million people in the next 15 years. In this country, there are 80 million people at risk for the development of diabetes. So how can we at the Joslin, with our years of experience, and to quote the words of Elliot Joslin, the diabetic who knows the most lives the longest, how can we at Joslin take advantage of our core knowledge and extend that to help so many people in the United States, but also in other parts of the world, including those who have less access to healthcare. Here are the opportunities for us at Joslin to partner with the Clinton Foundation and Health Matters and other prominent players to leverage the expertise that exists in this room to provide access to education for people at risk for diabetes or who have diabetes. And finally, we also focus on helping healthcare professionals manage this disease and teach patients lifestyle modification.
Because lifestyle modifications have a huge impact on the risk of diabetes, and diabetes isn't just high blood sugar or high blood glucose in the world of medicine. To us doctors, diabetes means premature death, heart disease, kidney failure, amputated limbs, and blindness. And so diabetes is a buzzword in medical parlance right now because so many people are affected, but it really does affect lives. I'd also like to introduce Carolyn Caldwell to the panel.
Thank you, Dr. Stork. And I would like to thank President Clinton and the Clinton Foundation for bringing the Health Matters Conference to the Coachella Valley for a third year. I would also like to thank Tenet Healthcare for being a lead sponsor once again for the third year. Desert Regional Medical Center has been an active participant in the blueprint process for the Health Matters initiative. Hospitals are vital to the health and wellness of communities. And we have to be seen not only as places where people come when they're sick or when they're injured, but also as part of the community and doing things to promote wellness and health in our communities. We have worked with our food vendor, Morrison's, over the last year to make sure that we're providing healthy alternatives to our employees as well as our community in our cafeterias. We'll cut back on the salt that is part of the way our food is prepared. We've also offering healthy options every day in our cafeteria and an expanded fresh salad bar. Something that we've also done is that we provided over 800 free flu shots this year to individuals who probably would not have had the ability to purchase flu shots on their own. We provide numerous free health clinics to various community organizations throughout the Coachella Valley. We also work with employers in the community. One thing I'm very excited about is that this past Saturday, we partnered with Catherine Fitchie Elementary School and provided T-shirts for elementary school kids to participate in the mayor's wellness and fitness race. So it was exciting to see elementary kids up at 7 a.m. racing instead of at home watching cartoons. One thing we did this year, Desert Regional Medical Center wanted to make a very bold step in the healthcare initiative. So we have partnered with Desert AIDS Project, and Desert AIDS Project is the most comprehensive HIV and AIDS service provider in the U.S. Desert Regional Medical Center has become the lead sponsor for the Get Tested Coachella Valley campaign in order to provide HIV testing to the residents of the Coachella Valley. There will be a mobile testing van as well as participation from the local emergency rooms. The CDC has estimated that 21% of the total number of people living with HIV and AIDS across the United States are not aware of their diagnosis. And also locally, a recent survey that was conducted by HARC, the Health Assessment Resource Center, determined that 70% of the individuals in the Coachella Valley do not know their HIV status. So we think by partnering with the Desert AIDS Project and providing free HIV screening using our mobile vans and through our emergency rooms will help remove the stigma and also help to improve community health and address this public health issue. Thank you.
Thank you. And what I love about this panel is, as a representative of a hospital, you know, traditionally we think of hospitals as places where you get care after you get sick. We are trying to change the healthcare paradigm where, yes, we want to take care of people after they get sick, but let's prevent the illness in the first place. Dr. Sokol.
Well, thank you, Travis, and thank you also to the Clinton Foundation for having me today and being part of this Distinguished panel, it's very exciting to be here, and I'm really happy we're talking about health and wellness and wrapping up with this conversation. My name is Mike Sokol. I'm the Chief Wellness Officer for Sanofi, which is a large global healthcare and pharmaceutical company. We have about 17,000 employees here in the United States, and we cover about 50,000 lives when you include dependents. So I'm here representing a large self-insured employer. And I know a lot of the discussion today is focused on a lot of the public initiatives that are going on, and I believe I'm here really representing the private sector and what large employers are doing in terms of health and wellness. So it's been a really fascinating role for me. I have a team that's been working on developing, implementing, and ultimately measuring a comprehensive, integrated health and wellness strategy for our employees and our dependents for the 50,000 lives that we cover. So basically, our main emphasis is really to empower our population to understand their health, provide them with the tools and the resources that are necessary to manage their health and improve their wellness, and then ultimately to measure. And I know there's been some discussion earlier about outcomes. Ultimately, we have to look at those outcomes. So our primary emphasis for 2014 really are three major steps. Number one, we want our population to understand their numbers, to get their biometric screening done. Number two, to complete a health risk assessment so they know what are the issues or the conditions that they need to focus on. And then thirdly, we're going to encourage them to speak with a personal health coach or a personal health advisor that will review the information from their biometrics, from their health risk assessment, and then really develop a personal action plan that each employee and adult dependent can follow to really improve their health and wellness. We want to make sure that we have a really wonderful, healthy work environment. So we've been working closely with our cafeteria vendors to provide nutritional information, healthy food options at work. Many of our locations have on-site gyms, or for those that don't, we're going to be providing on-site physical activity, as well as providing off-site physical activity, discounted gym memberships to our employees that are in the field. We are a tobacco-free company, so there's no use of tobacco or tobacco products anywhere on our property. And in fact, our CEO, Mr. Chris Viebacher, is the chairman of the CEO Roundtable on Cancer, showing our commitment to providing the tools and resources to help our employees and family members deal with preventing and treating cancer. So we want to make sure that all of our population has access to this. We want to improve health and wellness. And again, we're looking forward to continuing along this journey. And hopefully maybe next year you'll invite me back and I can show you some very exciting outcomes that we've achieved. So thank you.
Thank you. And I think you're highlighting what's important, which is in order to attain and maintain good health, it not only has to happen at home, but it has to happen when you go to work, when our kids go to school. That's an important concept we're going to talk about. I'd like to introduce Michael Miner.
Thank you, Travis. First of all, I'd like to say thank you to the Clinton Foundation for allowing us to be a part of the 2014 Health Matters Conference. It's a huge opportunity for us. Well over 100 years ago, our criminal justice system decided that youth and adult offenders should be treated differently. The first criminal courts was established in 1899 in Cook County, Illinois. The purpose of that court was to divert young juvenile offenders away from adult prisons and adult courts. Today, I have had the privilege to work with high-risk offenders for over the last 28 years, starting my career as a entry-level officer, and today serve as the director of the Division of Juvenile Justice. So again, it's an honor to be here with you today. A little bit about the population that we serve. The state system in California serves over 700 youth. Many of those youth come from low-income families, and a disproportionate amount of youth are colored. Many of the youth in our organization haven't had an opportunity to experience healthy lifestyles. Even though they're young, they come to us. Many of them are victims as well as victimizers. So it's a very difficult population to reach. We have over 700 youth in our system, and that's a little over 1% of the 200,000 youth that are arrested each year in California. We provide an opportunity for growth and change among those youth by providing them with skills based on a cognitive approach to help them develop those skills to change their lives. This opportunity to speak to you today, enhances our ability to reach out to the communities, because the facts are these young people will return to our communities. They are committed for very serious crimes. They have very serious criminal backgrounds, and they are in the most need of treatment. We have put into our program several components that are aimed to teach healthy lifestyles. First of all, we participate in the National Schools Lunch Program in order to provide them with nutritional meals. We also require that each student prior to graduation completes 20 hours of physical education. We also have implemented a robust screening program upon entry to identify those medical needs that they may have. And again, even though they're young people, they've treated themselves so poorly, so badly, that their medical needs are somewhat extensive often. We've also instituted into our programs, our treatment programs, a healthy living curriculum, and in our educational programs, a health education class. But the greatest opportunity for us today that I would like to highlight is our partnership with the Alliance for Healthy Generations. 2014 will be a great year for us working with the Alliance. They've committed to combine their Healthy School program along with their Healthy Out of School Time framework to tailor it to the juvenile justice environment. We'll be looking at overall wellness policies. We'll be looking at snacks and meals. We'll be looking at wellness and nutrition for our staff, which is also a very big component. In the public sector, it's not often you get a chance to do anything for your staff. And so that's pretty impressive for us. So we're really looking forward to the partnership that's being formed with the Alliance. I'm very excited about it. We've had champions on the ground ready to carry it on. We have an opportunity. Our success means touching the hearts and minds of some of the most troubled and damaged youth in California. There's over 225 youth arrested each year or detained in California. This 1%, or less than 1% that we have, are again the most troubled and the most damage that we have. Thank you for the opportunity, and a pleasure speaking with you today.
Thank you, Mike. And I'd like to introduce you all to Montel Williams.
Thank you, Travis. I know a lot of you wonder why I'm here. First, I'd like to say thank you to the Clinton Foundation and also to Health Matters for the invitation today. A lot of you may wonder why I'm here. I spent 22 years in our military. Some of you don't know that. I was in 2 branches of service, the Marine Corps and the Navy. I'm a Naval Academy graduate. I went on to serve for 17 years active as a special duty intelligence officer because my languages were Chinese and Russian. And when I left the service, I started the Montel Williams Show in 1991. And I believe that we, through the entire course of the show, made an attempt at trying to provide as much information as we could on everything from lifestyle to healthy living. And in my last 5 years of the show, I launched a project that was called Living Well with Montel. And having done so, I was asked this last year to become one of the faces of the Department of Defense's Healthy Base Initiative, where this last year 14 bases were selected to start a program that would emphasize 100% promoting a healthy and fit force, which is 100% essential to our national security. But what most people don't know is that because of this blight in obesity in America today, 1 in every 4 recruits who comes down to sign up has to be rejected. The number one reason for a person being exiting the service is because they can't meet the physical fitness requirements. And we're at a point in time right now in this country where, as we try to amass forces in multiple regions of the world, we're running out of physically fit personnel. Wow. Another part of this initiative is to increase the awareness of the devastating impacts of a sedentary lifestyle and to try to impress upon our soldiers and sailors to eat a nutritious diet. And you have to understand, when soldiers and sailors are deployed or you go to sea, fresh fruits and vegetables are gone in the first 5 days to 6 days. And then you're left with canned goods, and it's huge. Some of our ships have as many as 5,000 people on them, and it's pretty hard for the services to get a real grip on how to provide healthy food for the entire deployment. And so we're working on teaching our soldiers and sailors how they can make better choices even in the mess line, which they can do. Also, empower our military and the community to make better choices when it comes to exercise and tobacco use. And unfortunately, in our armed services today, $3 billion per year is spent on obesity and all of the pitfalls that come from tobacco use. And that's across the entire DoD community, including our family members, and those who serve with us on bases that are civilians. We kicked off this initiative at Camp Dodge in Iowa now 6 months ago, and on February 8th, I'm going back, and just like our U.S. military has led the way, I believe, in almost every social change in this country in the last 20 years, from equal opportunity to the acceptance of anyone, no matter who you are, wearing uniform, our military can lead the way in a lifestyle change, because what we're trying to do is get our military personnel on the bases who have family members living in communities near bases to teach their children healthier lifestyles so that they can then impart those in the schools that they're in. On February 8th, I'm going back to Camp Dodge, and we have the entire community showing up, because part of what's going to happen in this new Healthy Base initiative, sponsored by the DoD, is that local farmers will start setting up local farm stands outside of bases. Those children will go home from bases and hopefully become our stalwart motivators in their schools, from elementary school and to high schools. And so it's one thing to work on. But I've also, since departing from the service, from my career in a daily talk show, I've focused completely on my Living Well with Montel initiatives. And one of those initiatives this year, we signed the first CRADA, which is Comprehensive Research and Development Agreement, with the federal government this year, where because of taking advantage of my own situation and understanding how important it was for me to change my life, I completely changed everything about the way I eat, sleep, exercise. And if you would listen to the doctors who diagnosed me in 2000, I was supposed to be in a wheelchair in 2004. I see the top doctors in this country. I was seen by a doctor in 2007 and told again I would need ambulatory assistance in the next 6 months. And unfortunately, in that 3-year period of time from 2004 to 2007, I slipped a little bit. I wasn't paying attention to every aspect of how I've changed my diet, but everything from what I put in to what comes out to how I exercise to how I sleep, I've changed. And right now, though my diagnosis is for progressive, remitting, relapsing MS, which should have been a reason why I should have rolled in the back of this room, and I'm not knocking the fact that if I ever end up in a wheelchair, mine will just have spinners on it. So I'm gonna have a lot of fun. But I'll work out as much as I can. But the fact that I have changed my life is what now is responsible for the way I'm living with the disease that, as we talk about chronic illness.
And Montel is a living, breathing example of something that more and more doctors, including myself, are talking about, and that is this concept of letting food be your medicine. Hippocrates is known as the father of medicine, and many, many, many years ago, he said, "Let food be thy medicine." And unfortunately, far too often in this country, we've allowed food to become our poison. Food truly can heal or harm us. And so that's something I really want to start off with now. Dr. Rick Warren, you already introduced yourself, and thank you for all that you're doing. So we're all coming at this from slightly different angles, and yet we all have the same goal. And some of the sobering statistics that we've already shared with you, they're scary, but it's also a time of opportunity. In fact, we have never had more options to be healthy. We have never had more of an opportunity. So as I start this panel, I'm going to answer the question I gave the audience earlier, which is what percentage of healthcare costs are attributed to chronic diseases? And the answer is actually 75%. 32% of you chose that. 36% chose 56%. And we're getting a little bit too into the numbers here, but the point is that the great majority of healthcare costs, the great majority of illness is due to chronic disease. And some of it is obesity related, but as Montel just highlighted, multiple sclerosis. You wouldn't think that there would be any affiliation whatsoever with the foods we eat and the way we live, but he's a living example of that. So having said that, we all know that eating a good diet, being active, achieving emotional health, these are parts of a healthy lifestyle. Let's focus on this concept of promoting a healthy lifestyle, starting with maybe the biggest problem, and that is food. I went through some statistics, and it's a bit sobering. For each hour of television a child watches, they're 8% less likely to eat fruit daily. This is per hour of television. They're 18% more likely to eat candy, and they're 16% more likely to eat fast food. So in this day and age where there are a lot of easy opportunities to not eat well, let's discuss how we can promote better eating and better health.
Yeah, if I can jump in, Travis, I mentioned in my opening remarks that as a company, we try to encourage our employees to be healthy at work. So much of what they do is at the office. So in our locations, people come in, they work during the day. There's very little time really to go out to eat. So you really have to go to the cafeteria. So one of the key priorities we said was, well, if we've got people that are sort of a captive audience really, let's make these healthy options really available. So when I started with the company almost a year ago, I walked in for the first day, saw we had a lovely cafeteria, some nice offerings, but there was no nutritional labeling. I went over to the grill and I saw all the fried French fries and onion rings and chicken fingers and the pizza, and it all looked so wonderful, but I thought, wow, what an opportunity to really do something. So we decided to partner with our cafeteria vendor so that now every station in the cafeteria has nutritional information posted, calories, the percent from fat, how much saturated fat, how much salt, everything is labeled there. We got rid of all the fried foods and replaced it with baked items. There's always one entree that's completely healthy. We have vegan opportunities, so I see President Clinton has joined us. So, Mr. President, maybe you can come to Bridgewater, New Jersey, and I can treat you to a nice vegan lunch at the Sanofi cafeteria on me for having me today. So, for us, it was really important to make sure that as part of the work environment that we really encouraged a worky health environment, and again, a lot of that had to do with the healthy eating in the cafeterias.
I would also like to add that I think it also starts with the schools. We really have to acknowledge the fact that a lot of our children and our families are living in very socially economic environments where they don't have access to fresh food. They don't, as the president said yesterday, they live in communities where they don't have sidewalks to walk. And so I think that's where we have to, as business communities, work with our schools to make sure that kids are at least getting introduced to fresh fruits and vegetables at school, that they're getting out and exercising. Like the event we had this weekend with the mayor's race, that businesses are working with our schools and our community to support the children getting active, because unfortunately, and I've worked in minority communities before, a lot of these kids, when they go home, they have to eat whatever their parents buy for them, and oftentimes is processed foods, is whatever they can have access to. And so it's easy for us to say, we're going to eat fresh fruits and vegetables, we're going to work out, but I think we have to also address the fact that in a lot of communities, we have to really make sure that we're working with the communities and we're working with the school system so that these children can have access to fresh food, that they can be active, and that they can work out as well.
Let me just add one more thing. I think that there's an area that I unfortunately have to admit we fall down in medical education. There is not enough nutrition taught at medical schools, and not enough about lifestyle at medical schools. We need to engage our medical school curricula far more aggressively at promoting nutrition and understanding of nutrition, and how lifestyle can impact so positively, or changes of lifestyle can impact so positively on the prevention of the chronic diseases that we're speaking about. And I think the second area, of course, is at the level of the consumer, the patients that we see. Nutrition and exercise are such core components of managing chronic disease, and therefore, as I said earlier, preventing chronic disease. We need to find ways that we can get this information to more and more people in the rest of this country, and for that matter, around the world.
Travis, I got to jump in here, because part of what I think the biggest problem is, and we can make excuses, and I'm not saying anybody has done so here, excuse after excuse after excuse, as to why people don't have the education they need, when if we started by just doing as much work in our business as we could do. Right now, the biggest viewed television shows are all based on reality programming, and not one person in the houses that every child in this country looks up to tries to or attempts to eat a healthy lifestyle. We in this industry are the ones who control the budget by which they get to film their shows. And so I don't understand why we can't, in the media, start a campaign that says we want all Americans to take responsibility for their individual healthcare footprint. We're asking for manufacturers of oil and other products to take care of the carbon footprint. Let's start taking care of our individual healthcare footprint. And then when we start messaging that, and I'm sorry, I'm not picking on them, but if I watch the Kardashians, if you watch them for 5 days in a row, and every day Kim Kardashian started making a healthy shake in the morning, trying to promote it to her brothers and sisters, every child across America would think that that's cool. But we're missing out because what we'd rather do is show them sitting in restaurants, blinging and all these kinds of things. So part of this is our responsibility and how we message and how we reach out to our children.
And
we
that
gotta
is
stop
so
this.
true. And what I love about this particular conference, and thank you, President Clinton, for raising this awareness, because sometimes I host a show called The Doctors, and I have to always give the sobering statistic. Obviously, I have to tell what I call the truth when it comes to your health. And we are fighting a lot of popular messaging out there, and it can be a challenge. And so, to some extent, good health is a grassroots movement. It does require better education of physicians. I had a grand total of 2 hours of nutrition education during my entire medical school experience.
I think you're lucky. Some people have none.
It was a really good 2 hours from what I remember. So acknowledging that good health and good nutrition requires more and more of us talking about it, and anyone in the media telling the truth and what's important when it comes to nutrition, that will help. So acknowledging that nutrition plays a huge role. Dr. Warren, you mentioned some of the steps that you've taken. When we look at getting people more active, how can we do that in a way where it's not intimidating? Because most people think that they have to have a gym membership to be active and have it be worth it.
Well, the first thing you have to do, these diseases, chronic diseases that we're calling diabetes, heart disease, they're communicable diseases. And study after study after study shows that if your friends eat junk food, you're going to eat it too. This is what we call the friend factor. It's one of what we call the secret sauce in the Daniel Plan. And the single greatest issue for changing the health in America is the community of the people you associate with. If you associate with people who have bad health habits, guess what? You're going to have bad health habits. Saddleback's the only church in America that actually has more people in small groups than on Sunday. Last Sunday, we had 25,560 people in church. But I have 35,000 in 7,018 small groups that go from Santa Monica to San Diego. In every one of those small groups, we enlisted a health champion. That health champion is responsible for communicating the positive ideas of eating right, exercising. It's not rocket science. We already know you got to expend more calories than you take in, and you got to take in the right kind of calories. Food is information, as the Hippocrates quote that you said, that food is medicine. We know that. It's not just food. What we're not doing is we're not taking advantage of the community factor. And churches, synagogues, mosques are natural places like this, but you could do it in a business. You can do it in a school. There is positive peer pressure. If you're going to change the behavior of people, you can't do it by focusing on individuals. You have to focus on a group.
And I like that whole idea of we are a community in this, and when you as an individual, when you decide to make health your hobby, all of a sudden your spouse and your friend, they make health their hobby, and so do their friends. And it really does work. When you start to look at diabetes, let's get back to some of the work you do. Every 17 seconds, someone in this country is diagnosed with diabetes. That, along with obesity, is the health epidemic of our time right now. Are you finding that within the medical community, we're starting to do a better job of teaching diabetics things that they can do to help manage their own disease?
Empowerment is the key to success in managing diabetes. And so that's what the focus has been at the Joslin Diabetes Center for years, ever since it was established. In fact, I would say that Elliot Joslin was the first disruptive innovator in healthcare, because he realized that alone he couldn't manage people with diabetes. He needed a team. So he took a nurse from what was then the Deaconess Hospital, and he taught her to go into the homes of the patients and the families diagnosed with diabetes. And he taught not only the patients, but he taught the entire family. She did healthy nutrition, at the time how to boil the syringes for the administration of insulin, We've come a long way in that regard as well. But she was called the wandering nurse. And that was his team. He used to have classrooms full of patients who he taught about aspects of managing diabetes. And I think today the opportunity is really how do we actually take this wandering nurse and become a virtual nurse, and she can or he can be in the homes of every single person who either has diabetes or is at risk for the development of diabetes. That's the key to success.
And unfortunately, we are running low on time, but I want to tackle this question from Valentino on Facebook, who asks us, what do you believe are the biggest obstacles towards promoting healthy lifestyles in the United States? Because as I said before, there have never been more opportunities to be healthy, but there are still a lot of obstacles out there. Anyone want to take this?
Well, I may start, Charles, by saying that our situation is a little different than most. The youth that's in our care are with us for an average of 34 months. So in other words, we're actually serving as a surrogate parents for those youth while they're in our care. So we have an opportunity to really influence their behavior. We have an opportunity to influence upon them positive lifestyles. The challenge that we have is upon release what happens to them. I mean, they're going back into some of the same neighborhoods, some of the same communities that are broken, families are broken. Again, many of the youth that we serve are victims as well as victimizers. So we have an opportunity, and that's what's so exciting about the work that we're going to be doing with the alliances, because what I'm looking for is new ideas, new creative ways that we can build not just those things, instill it with them while they're with us, but be able to transcend that when they leave the facility. And that's the challenge that we have.
I think it's also what we've been doing here this week is pulling all of the community resources together. And it's, as Montel said, as we begin to see more and more role models that children are looking up to, and even people that we're looking up to that are talking about health and exercise and food and making positive decisions. But I think it's going to take all of us. No one organization or one group can do it alone.
Travis, if I could jump in right on that same thought. You know, one of the things that we haven't discussed at all day, and it's an important issue that is facing us like the freight train running down the track. You know, by 2020, right now today, we are 18 to 20,000 doctors short, 300 to 400,000 nurses short. It's anticipated by 2020, the current doctor population, which is about 830,000 doctors across this country, over 50% of them by 2020 will be over the age of 65. We are not in any way, shape, or form doing, I think, what is the most important thing in this country today, and that's convincing our children to go into degrees from engineering to the medical community, even from the standpoint of nurses. By 2020, when the president had spoken earlier about this freight train of chronic illness coming down the track, folks, we're not going to have enough doctors here to even think of taking care of the level of people who are going to be sick in this country. And if we don't do something about educating this generation to go to school and not become a rapper or a singer or a dancer or a model, but go to school to maintain this infrastructure, forget about wars, forget about Affordable Care Act. That's not going to matter. This country is going to start falling apart in less than 6 years. And these are numbers, you look them up yourself, folks. We don't have enough students in college right now to even come close to meeting the gap in the number of doctors that we're going to have. So one of the most important things about healthy lifestyle is not only teaching children about a lifestyle, but teaching them that they also can impact others' lifestyle by getting an education. And until somebody in this country starts talking about that, all of these conversations really are almost moot.
If I could just add real quick, Travis, I think, from my perspective in the corporate world as well, I think there are a lot of employers out there that don't necessarily think that this is their role, to be involved, to take an active role. And I think the more, again, that we can get the private sector working with the public sector to collaborate and to get companies to understand that by creating a culture of health at the company, that's critical. And I think also it really comes down to all of us individually taking personal responsibility and accountability for managing our own health. For a lot of folks, they go into work, they get these wonderful benefits, and they think it's a terrific thing. Part of what we're trying to do at our company is to say, we give you these wonderful benefits, but we do have an expectation that you will take some accountability and responsibility and work together to make this happen.
And unfortunately, we have run out of time, and I appreciate everyone's comments. I think when we talk about good health, it can be really intimidating. And from a physician's perspective, I will tell you that I actually believe that good health occurs in between doctors' visits. We need more doctors. Thank you for saying that, Montel. We need patients to be our partners in health and be excited about their own health. I call it being the CEO of your own health. But for some people, it's as simple as redefining fast food. That afternoon snack can be a handful of nuts, which ironically can help you live longer. That one simple change. It doesn't mean getting a gym membership as much as it can just mean going for a 30-minute walk every evening with your kids or your spouse. These subtle changes also improve emotional health. I talked earlier today about how emotional health is tied in with the prescription drug abuse epidemic. It all is this holistic approach, and I think for the first time ever, the fact that we're having these conversations means that we're headed in the right direction. So thank you to all the panelists, and thank you all so much for being here, and thanks for watching at home if you're streaming online.